Hello, dear students and esteemed learners. Welcome to my course on Sociology of Health. Now, today we have lecture number 22, and the topic that I have selected for today's lecture is Public Health in India, Definition, Goals, and Agencies. In the previous lecture, we tried to understand the concept of public health. Basically, we tried to see how public health emerged or evolved as a effort or fight against the pandemics and epidemics and the mortalities caused because of the communicable disease, and then the quest for survival. Because historically, over thousands of years, humanity has been suffering from the premature mortalities caused because of many of those historic epidemics, which gradually got converted into pandemic also with the movement of people or migration of people from one part of the world to the other part of the world, right? Many of those diseases were basically waterborne or airborne, right? But as we have discussed earlier also, biomedicine primarily emerged in the late 19th century and early 20th century. So the way we are witnessing the functioning of medical system or medicine system, it was not like that 100 years before. This journey is basically new and recent. So prior to the emergence of this modern system of medicine and some of the very important traditional systems of medicine, there was a kind of effort by people at large, by the administrators, by the policymakers, and of course, whatever kind of health services were available at that point of time. So there was a kind of collective effort to ensure healthy living, and that got converted into or converged into the concept of notion of public health, so that we understood in the previous lecture, that is lecture number 21. We also saw how it emerged in the United Kingdom and then in the US also. Now today we will try to understand the functioning of public health in Indian context. I tried to find out literature on this particular aspect, that how public health in India is defined, or how what kind of basically structure we are following in public health issues in Indian context. So this lecture is an effort to understand the things in Indian context. I have included several concepts here. We have started with the World Health Organization's definition of public health, and then tried to identify the goals and means of public health. And then we have also seen how interdisciplinary the nature of public health is, because if you want to identify the various components of public health, then we need to trace the contribution of the multiple agencies in that. So the functioning and the agencies of public health, I have also tried to find out in this lecture. And then very briefly, we'll talk about the kind of health condition which was prevailing at the time of independence in India, and then what kind of initiatives we have taken comprehensively. So these are the concepts that we are going to cover in this lecture. Hope you will find these things relevant. So we will begin with the definition of public health as given by World Health Organization, because this is the most important agency, and so far we have taken most of the definitions from World Health Organization. The expert committee of World Health Organization on public health administration, way back in 1952, has defined public health. Now, according to this definition, public health is the science and art of preventing disease, prolonging life, and promoting mental and physical health and efficiency. So, this is a long definition. I have provided you the comprehensive definition in this slide also, but we will talk about the different components which are there in this definition. So, it is the science and art of, but basically, it very categorically says that there is a science and there is art also. That means there is convergence of multiple approaches. So the very first statement in this definition talks about a kind of convergence of multiple approaches. Then it's about preventing disease, it's about prolonging life, and it's also about promoting mental and physical health, and not only health but also efficiency, because health provides efficiency. So lack of health is also about lack of efficiency. So very often it happens that people are not having much worry about illness or sickness, but they may feel that they are not feeling that much efficient because of lack of certain things. So the word efficiency is very important here. Then how to provide these things? The second part of the definition is talking about that through organized community efforts. Now, it is not stating here that through medical care. Now, that is the most important thing that we need to take into consideration. It says that through organized community efforts. That means here we can see a departure from the kind of definition for medical care practices are there, and the kind of definition for public health is there, right? So, this is important. Through organized community efforts for the sanitation of the environment, control of communicable infection, education of the individual's personal hygiene, organization of medical and nursing services for early diagnosis and preventive treatment of disease, the development of social machinery to ensure to every individual a standard of living adequate for the maintenance of health, and so organizing these benefits as to enable every citizen to realize his birthright of health and longevity, right? So this is a long definition, but it talks about almost every possible dimension related to public health. And what is very important here is that it begins with the terms like organized community effort. Now we know that community effort means basically community is basically the kind of location that we are living in. Often we say that the rural community or the urban community or the neighborhood. So basically where we live, right? And if we make some kind of effort at that level, at the grassroots level, that is a kind of community effort, right? And for sanitation and environment or sanitation of the environment. So we saw it in the previous lecture also that when public health developed in England, then they basically started with sanitation, then water, then taking care of the sewer system, the drainage system. So public health is talking about all those aspects which are somehow responsible for causation of the disease, right? So it talks about making some kind of restriction, constraints, so that the disease should not come into existence at all. That is the difference in the approach of medical care or the basically curative care and this public health. Now, I've tried to identify the goals as well as the means for public health, right? Because this definition given by World Health Organization is talking about both. So, what are the goals of public health? The goals, as mentioned, now I have mentioned it here also. The preventing disease is one of the most important goal. Now, how can we prevent the disease from its occurrence? There can be several things. Medical care is definitely one important thing. Then food and nutrition, because without food, we cannot think of health, right? And then potable water, because there are several types of disease which are waterborne, right? So safe drinking water. Then screening of some of the disease at the earlier stages. Then vaccination, of course, vaccination is very important. Then sanitation, then waste management, disaster management, road safety, health education. All these factors can play very important role in preventing disease. So one of the goal of public health would be preventing disease and all these components that I have mentioned here. Then prolonging life. Prolonging life means people should live maximum, not only in terms of years, but also in terms of health and their efficiency. That is what is prolonging life. So for that, basically reducing mortality, that means premature mortality we are talking about, the reducing premature mortality and morbidity, then increasing life expectancy and reducing disability also. Because again, disability basically creates several types of constraints in life. So prolonging life will take into care all these components. And then promoting mental and physical health and efficiency. So basically for maintaining mental health, there are several other factors or components required which are not necessarily related to what are necessary for maintaining the physical health. Of course, those are important because a healthy body or basically taking care of the physical health is very important for ensuring mental health. But that is not enough. There are other components also like peace and harmony. The peace is very important for the mental health. So at that level, the society needs to have some kind of peace also, right? Some kind of harmony also. Because you may remember we talked about the definition of health, and their mental health and social health were very important components. So mental health cannot be taken care of without social health, right? So these are interlinked, these are interconnected, and that is why we are saying here that if we want to promote mental health, then we need to take care of the peace and harmony also. Then the quality of life also, because quality of life includes several types of things, right? Some of those could be related to the material things, and some of those could be related to the non-material things, right? So the overall way of life is basically deciding the quality of life. So that is very important. Then the civic amenities, basically everything we talked about, right? From water facility, electricity facility, roads, then all other facilities in the vicinity that we are living in, right? Those are the civic amenities. Then occupational health, because people work, so the work climate should be such that there should be a good health. Good health could be maintained. We talked about this in few other contexts also, and that is more applicable basically for the health of the women, right? Then there are other things like reducing pollution, then increasing road safety. Road safety is very important because there are so many accidents which take place in the roads, and those lives are very precious. So pollution is again very important factor, because that is somehow creating lots of respiratory disease, right? And we have seen that respiratory disease has remained one very important cause of mortality. So we can identify from the definition given by World Health Organization that there are specific goals, and we can divide those major goals into sub goals, as I have attempted is this slide. Then there are basically the means which are identified in the definition itself. We talked about that, but yes, you can have a look on the means. Everything which we stated in the definition, organized community effort should be there, then sanitation should be there, then some kind of control of the communicable disease should be there, and all other factors that we basically already talked about when we were talking about the definition. So what is coming out from this discussion? That interdisciplinary approach is required for public health. It is not confined to the domains of system of medicine or biomedicine. Whether that is biomedicine or that is traditional medicine, it is not confined to that. It goes beyond that, right? And we are taking care of all possible domains or factors which are influencing health, life, and quality of life in our society or in our social life. So there are several professionals who are playing very important role in deciding the quality of public health, right? For example, the physicians, surgeons, and health practitioners, they take care of the medical aspect. Then there are sanitary engineers. Sanitation is very important component of public health. So for that you need engineers, and of course the sanitary engineers are more a specific thing. Then the epidemiologist. Basically, epidemiology is an important approach to study the spread of disease. We'll talk about this topic also in this week's lectures. Then statisticians, basically, because when we were looking at the slides related to the epidemics and pandemics, then we get to know that there are huge numbers. So basically, disease and then mortality, then fecundity, and then morbidity, and all these basically need some kind of statistic and some kind of projection, because for prevention we need to have some kind of projection, and for that we need some sort of contribution of the statisticians. Then we need good laws, right? Then we need good counselor, good regulator, good lawyers, then paramedical and nursing staff, then sanitary inspectors, then economists, sociologists, anthropologists, etc. That means when we talk about public health, this is a kind of convergence of or engagement of all these different types of professionals. Collectively, they make the quality of public health. So this is the broader spectrum or perspective with which we will try to identify public health in Indian context. Now, next important question for us is that what are the agencies who work for public health in India, right? So earlier we have stated that at the level of the union government, there are two important ministries: Ministry of Health and Family Welfare. It has two departments: Department of Health and Family Welfare and Department of Health Research. And then second is the Ministry of Ayush, which is basically dealing with the Ayurveda, Yoga, Unani, Siddha, Homeopathy, etc. Right? So these are the two important ministries which is taking care of the medical care or healthcare aspect. But are these the only agency to take care of the public health? No. For answering this question, basically we need to take help from whatever we have stated just in the previous slide, that public health needs contribution from multiple agencies, right? And public health needs contribution from multiple professionals, right? So what kind of basically a system is there to achieve the goals of public health in India? So in India, if you look at the functioning of the government, the union government or the central government or even the state government, then we are having specific ministries, right? Because we are following the sectoral planning system, right? So there are different sectors. For a specific sector, there are one ministry, right? There are several ministries. But as we have already identified the various components of public health, which includes not only medical care, but also basically nutrition and food, then water facility, then household facility, then basically some kind of construction of the sewers, right? Then drainage system, then basically road safety, then parks, etc. There are so many things which are required for ensuring good public health along with the healthcare facilities. So I have identified the ministries whose work are basically somehow related with public health, because all these ministries need to play an important role if you want to improve the quality of public health in India. So I have grouped those ministries. The first two, Health and Family Welfare and Ayush, are primarily responsible for taking care of the medical care aspect. Then Ministry of Water Resources, then Consumer Affairs, Food and Public Distribution. You know, food and public distribution are very important because food is very important for us, and distribution of food is very important because in India we are having huge number of people who are having basically the financial issues, the issues related to affordability of food also, right? So in India we have the very strong system of public distribution through which some kind of subsidy is given, and along with that basically it is ensured that the food should reach to people, right? So public distribution system is very important, and we are having a very important ministry. So that comes here. And then the Housing and Urban Affairs, because this is related to the kind of housing facility which is required, or basically several schemes run by the government to provide houses to those who cannot afford, right? Then Transport and Highway, Then environment, of course, we have been talking about the contribution, the role of environment, the need of taking care of environment, and then education. All these ministries basically take care of the various social factors, right, and various environmental factors which are integral component of public health. So if all these ministries can work properly, appropriately, then only the proper environment of public health could come into existence. So we need to appreciate that these are all important agencies of public health. Then I have mentioned three ministry which take care of different segments of population, basically the women and child development, then youth affairs, and then the labor and employment, right? So these three ministries do take care of some kind of important target groups, right? If we can take care of these target groups, then it will be very convenient to ensure their health. And then there is another set of ministry like the rural development, urban development, and tribal affairs, which talk about different types of communities. Because we had already seen that it is primarily beginning with organized community effort. So these ministry do take care of some kind of development in these different at this community level, because without having proper development of the communities, this organized community effort will not be possible, right? So these are the various ministries. And then at the last but not the least, very important, that is the Ministry of the Panchayati Raj, because we will see that the local self-government is a very important agency for ensuring public health, right? That is the most important agency for ensuring public health. So through the Panchayati Raj system, the efforts are made to ensure good functioning of the Panchayati Raj system at the rural level, right? So we'll talk about that also. But at the level of the union government or the central government, these are the different ministries which take care of all broader issues related to public health, right? Then, of course, we have a federal structure. So along with the union or the central government, we have the state government and the union territories also. So although there are several important programs and policies. Of course, all the national policies are decided by the central government. Then there are many important programs like NRHM or Ayushman Bharat. You would be knowing about other programs in some of the other lectures. These are actually initiated by the central government, right? So these are the massive programs for taking care of the health of the people, health of the population, and of course these are the major intervention in terms of ensuring good public health. So, but keeping aside the role of the central government, the state governments do have some specific role, right? They also have the respective ministry where they ensure that all-round development of the specific areas should take care of, right? And what is very important, that the very important agency for execution of the public health related development is the local self-government, basically the municipals, right, and the panchayats. So the state governments are responsible for managing the urban as well as rural local self-government institution. So their role is becoming very important. If the state governments, various ministries are not working in coordination with the local self-government agencies, then we cannot ensure good quality public health. So this is the state governments are very important, right? Then we come to the urban local bodies and their role in public health. This is very important. The government of India had issued a model municipal law in 2003, way back in 2003. And this model municipal law is basically talking about the various types of functions that the municipal corporation are supposed to provide, or the kind of services that the municipal corporations are actually supposed to provide. Because we had the 74th Constitutional Amendment Act, and that made the urban local bodies more functional. We had the 73rd Constitutional Amendment also, and that has made the Panchayati Raj institutions the constitutional agency, right? So these were the interventions, but we are not interested in talking about all those issues related to amendment of the constitution or other things, but we want to focus here on the kind of role which are prescribed or suggested for the municipal corporations by this model municipal law. It helps us to understand the kind of role that the municipal corporations are having. And we all know that there are different levels of municipal corporations, which are basically depending upon the kind of population, right? The districts or the towns are having. But without getting into the details of that, we will talk about the functions only, because we want to understand here that that urban local bodies are very important agency for ensuring public health. And we all know that in India there are different states, then the union territories, and they vary from one to another. And so the structure of the municipal corporations or the urban local bodies would be different from one state to another state. So without taking into consideration those kind of variation, we'll talk about the functions that these are basically performing. So there are important functions identified here. One is the public health includes water supply, sewerage and sanitation, eradication of communicable disease, etc. Right? So very categorically it is mentioned that when we talk about public health, then it will include these 4 important components, and it will be the responsibility of the local self-government to facilitate these things, to provide facilities related to that. So water supply is basically the lifeline in any city. That is a lifeline in rural areas also, but basically the urban life is little different from the rural life, right? Because we may have some other sources of water in the rural areas, but in urban areas we don't have other sources of water except the water supply, right? So if the quality of water is not maintained, then that is going to create huge health problem, right? So water supply is one of the most important duties or roles of the urban municipal corporations, and that is one of the most important factor of public health. In any situation, if there is any kind of compromise with the quality of water, we can imagine the kind of problem it may create, right? So we can understand that the most important role in ensuring good public health would be that of the urban local bodies, because they are providing the most essential work like supply of water. And when water is supplied to the household, then people not only consume that but also make use of it for the multiple functions. And then there is wastewater. So if there is enough amount of wastewater, then for that there should be a proper system, so that that wastewater should go to the places where it can be reused or whatever way it can be handled, right? So the sewerage system is very important. So sewer system, then sanitation and water supply, and these are most essential factor for basically preventing the spread of communicable disease. We have seen that in the first phase of growth of public health in the United Kingdom also, they basically started with those functions, right? So at that point of time, basically, because urban local bodies spread all over the world, right? And from that time only, the urban local bodies started to perform those kind of functions. The next important thing is regulatory functions related to prescribing and enforcing building regulations, encroachment on public land, birth registration and death certificate. So there are very important things which are basically related to the regulation of the public life or the urban life. So these are also performed by the urban local bodies. Then public safety like fire protection, street lighting, etc. These are very important component. Without these, basically the public life will get jeopardized, and these are taken care of the urban local bodies. Then public work measures such as construction and maintenance of inner city road, etc. And then some sort of facility for education and recreation. So these are all very important component, and I have highlighted only those aspects which are directly related to public health. But because there are several other duties or responsibilities of the urban local bodies also, but we are not talking about those things as of now, because the lecture is not about the functioning of the urban local body but about the public health, right? So these very important functions are provided by these agencies. And then we have the Panchayati Raj institutions. So in India, we are having a Panchayati Raj system, and then we are having basically 3-tier panchayat system. So Gram Panchayat, Panchayat Samiti, and Zila Parishad. And then at the bottom level, we have special functionary like ASHA, then ANM, then Village Health Sanitation Committee, right? So these are the various agencies which are working at the grassroots level in the rural areas also, and they are also playing very important role in public health. Then construction of toilet, household, road, etc. Very often these are funded by the central government, and sometimes these are funded by the state government, and the panchayat institutions have a very important role to play in ensuring the quality of work. So these are very important. Then we talk about the private sector and the civil society. Not only the government sector is playing important role, but also the private sector is playing important role, because at the level of the medical care facilities, we see that in India, most of the medical care facilities, basically largely, I think up to 60%, right? 60 to 70% of the medical care facility is provided by the private sector, whether in the form of the clinics or in the form of the large hospitals, right? So that is a huge contribution, because everything that is essential for maintaining the curative health, right, or the preventive health, is basically monitored by these biomedical or other traditional system of medicine practitioners. So that is very essential. Then we have the civil society organizations, like one name which is coming to my mind is Sulabh International, which is working to enhance the sanitation facility, public toilets, and then several other corporate sector which are doing wonderful job, basically under the corporate responsibility or under various programs, where they are doing great job in ensuring good public health, right? So when you identify the agencies, of course we can identify all these agencies that we have mentioned. Then what was the status of public health in India at the time of independence? It was not very good. I have included certain figures here which were published by the report of the Expert Committee on Public Health System 1996. We can see that the state of public health was not very good at the time of independence. Time will not allow me to talk about these things, but we will talk about these things in some of the other lectures also. And then there are important initiatives which are taken, and we have talked about most of the initiatives during the course of this lecture. So again, time will not allow me to talk about these things, but we have, I think, included most of these sections. One or two important thing which I need to mention here is this, that in India we have developed very authentic data about the health status of people, right? So health information is very important. That is one important advantage that we are having as of now. And then the use of the technology, because technology has also made it possible to provide healthcare service in several possible ways, right? So these are the various things that we are doing in the domain of public health. In India, public health is basically moving in the right direction, and still we have to go a long way, because in this course we will have several other lectures where we will talk about many of these components specifically. There we will try to understand where do we exist as of now. So till then, take care. We'll meet in the next lecture.